Good evening, guys. Thank you so much for joining us today on this workshop. We are starting in just 2 minutes, so just call your friends or family members who are trying to join this webinar. Good evening, guys. Welcome to our workshops on Let's Talk About Anxiety, the workshop which is conducted by Mrs. Anila Sehgal. I am Ria Kurania, founder and therapist at the Psychic Mantraa, and I'm welcoming you all for our one-day workshop on anxiety. Next slide, please. Yes. So before we start, let me tell you about who is Miss Anila. Miss Anila Sehgal is a visionary behind Dukh Nivaran. So she is the therapist and founder of Dukh Nivaran, and she is also a 16. She also has a 16 years of experience as a physiotherapist, and sharing her views and her in detailed knowledge about what exactly the anxiety is and what are the main intervention that we can use to overcome with this mental health disorder. Thank you so much, Ms. Anila Sehgal, for being with us here today. Over to you, Anila ji.
Hello, Ria. Hello, everybody. Thank you, Ria, for a good introduction. A very good evening to all the talented people out there. My name is Anila Sehgal. I'm your facilitator for this workshop. I have been working as a lead healthcare professional as physiotherapist from last 16 years. I have done my master's in counseling and family therapy. I am founder of Dukh Nivaran Holistic Care Services. Today we will dive into a pervasive topic which is occasionally ignored by many of us, anxiety. Next slide, please. थैंक यू। ये टॉपिक जितना वास्ट है उतना ही इग्नोर्ड है। मैं पूरी कोशिश करूंगी आपको इजी लैंग्वेज में एंजाइटी के बारे में सारी इंफॉर्मेशन दे सकूं और उसे मैनेज करने के तरीके सिखा सकूं। प्लीज स्टे विद मी टिल एंड। We'll start with a general introduction of anxiety. If I may ask, How many of you have ever felt anxiety or faced panic attack in your life? आप में से कितने लोगों ने अपनी लाइफ में एंजाइटी को एक्सपीरियंस किया है? माइंडेड एंजाइटी इज डिफरेंट फ्रॉम स्ट्रेस। स्ट्रेस यानी तनाव एक मानसिक स्थिति है जिसमें किसी परिस्थिति से निपटने में परेशानी होती है। Stress is a response to an external situation like a deadline or argument inside our body, while anxiety is a person's reaction to stress and can also occur without any trigger. एंजाइटी यानी चिंता का रिश्ता डर और बेचैनी से जुड़ा होता है, जहां स्ट्रेस इज अ शॉर्ट लिव्ड and ends as stressor goes away, while anxiety lingers on even when there is no identifiable stressor. People give me thumbs up if you have ever faced certain situation which have raised your stress level to anxiety. कभी काम के तनाव में, किसी एक्सीडेंट को देखकर, किसी की गंभीर बीमारी, भविष्य की चिंता, स्टेज पर जाने से पहले भी, कभी भी। या थैंक यू। यहाँ एक बात बताना चाहती हूँ कि स्ट्रेस और एंजाइटी एक सीमा तक रहें तो बुरे नहीं हैं। दे मोटिवेट अस टू परफॉर्म बेटर एंड स्टे प्रिपेयर्ड बिफोर हैंड। जब एंजाइटी या स्ट्रेस क्रॉनिक हो जाते हैं, वह शरीर को बीपी और हार्ट प्रॉब्लम्स जैसी परेशानियां दे देते हैं। एंजाइटी इज लाइक अवर स्मोक अलार्म। इट हेल्प्स अस रिमेन अवेयर। वी फील एंशियस इवन दो वी आर एक्चुअली सेफ इन प्रेजेंट मोमेंट। किसी पुरानी परेशानी को याद करके भी हम एंग्शियस हो जाते हैं, है ना? नाउ स्ट्रेस यानी तनाव में हमें गुस्सा आता है, अकेलापन लगता है, चक्कर आते हैं, मन उदास रहता है, जबकि एंजाइटी में हमें परेशानी महसूस होती है, हम टेंस रहते हैं, बेचैनी होती है, हमें पसीना आता है। पर इन दोनों में ही हमारी हार्ट बीट इंक्रीज हो जाती है, ब्रीदिंग इंक्रीज हो जाती है, स्टमक में टेंशन महसूस होती है। नेक्स्ट स्लाइड प्लीज। Now, normal anxiety can be different from abnormal anxiety. Normal anxiety can be survival mechanism which activates fight or flight mode in a person. Example, when crossing busy street, we may feel anxious. But abnormal anxiety, when anxiety becomes irrational and interferes with an individual's ability to function normally in daily life, it becomes abnormal. Next slide, please. अब एंजाइटी को आसान शब्दों में समझाने के लिए उसके लक्षण जान लेते हैं। सिम्टम्स ऑफ एंजाइटी कैन बी ऑटोनॉमिक, सोमैटिक, साइकोलॉजिकल। मैं आपको पहले से सिम्टम समझा चुकी हूँ, ब्रीफ में बता चुकी हूँ। अब इसको थोड़ा इलेबोरेट करके समझते हैं। ऑटोनॉमिक अराउजल एक्टिवेट्स वन सिंपैथेटिक नर्वस सिस्टम, दैट इज द राइट साइड ऑफ आवर ब्रेन, resulting in physiological symptoms such as shortness of breath, palpitation यानी घबराहट होना, चेस्ट पेन होना, स्वेटिंग, डिजीनेस यानी चक्कर आना। एंजाइटी अटैक को कई बारी लोग हार्ट अटैक से भी कंफ्यूज कर सकते हैं। सोमैटिक सिम्टम्स इंक्लूड मसल टेंशन, फटीग, मसल पेन्स, हेडेक्स, numbness, etc. साइकोलॉजिकल सिम्टम्स में इंक्लूड पुअर कंसंट्रेशन यानी किसी काम में हमारा ध्यान ना लगना, इंसोम्निया यानी नींद ना आना, इरिटेबिलिटी, रेस्टलेसनेस, एक्सेट्रा। नेक्स्ट स्लाइड प्लीज। थैंक यू। नाउ टाइप्स ऑफ एंजाइटी अकॉर्डिंग टू Diagnostic and Statistical Manual of Mental Disorder, 5th edition. Anxiety is divided into following 9 types: पैनिक डिसऑर्डर, स्पेसिफिक फोबिया, ऑब्सेसिव कंपल्सिव डिसऑर्डर यानी ओसीडी, पोस्ट ट्रॉमेटिक स्ट्रेस डिसऑर्डर यानी पीटीएसडी, जनरलाइज एंजाइटी डिसऑर्डर, एंजाइटी ड्यू टू मेडिकल कंडीशंस, सब्सटेंस इंड्यूस एंजाइटी और सेपरेशन एंजाइटी, selective mutism. Can I please ask everyone if any doubt or query is over there? किसी को कुछ पूछना हो, कुछ समझ ना आया हो till this part? We should move on then. I would like to focus more on intervention part quickly. Next slide, please. Now, levels of anxiety. Anxiety can be divided into four levels according to its severity: mild, moderate, severe, and panic. I have seen someone has raised hand. Can I ask? Yeah,
Um, Hi,
yeah,
ma'am.
yeah,
I just wanted to let you know if it's possible for you to, keep it in English because I'm not that fluent in Hindi.
yeah, ma'am. That is perfectly understandable. But I have all genres of people in the group, and I had to make it accessible to everybody. I will try to be in English as much as possible.
Maybe, both, but
Yeah,
yeah,
that is okay for me. I will
okay.
try to. Yes, thank you, ma'am.
Thank you.
Now, anxiety can be divided into four levels according to its severity: mild, moderate, severe, and panic. Before explaining them, I'd like to show you a small video to make you understand anxiety better. And also, I'm really very sorry to give you this kind of anxiety and experience this anxiety throughout my video. मैं आपसे माफी चाहूंगी इस वीडियो के बाद आपको कुछ एंजाइटी का एहसास हो सकता है आपको अभी से 0 से 10 तक रेटिंग स्केल पर एंजाइटी लेवल को रेट करना है और चैट बॉक्स में लिखना है 0 आप बहुत शांत हैं अभी आप प्रेजेंट लेवल में यू आर परफेक्टली ओके यू हैव टू रेट फ्रॉम 0 to 10 0 being your perfectly normal state of mind and 10 being you're completely anxious right now. Kindly let it down in the chat box. Then we will show you some video and I'll again ask you your anxiety scale. प्लीज चैट बॉक्स में लिखिए आपका रेटिंग स्केल 0 से लेकर 10 तक आपका रेटिंग स्केल क्या है एंग्जाइटी के लिए. Hi there again. Please do not panic and let me know how it feels like to you. Welcome back. एक गहरी सांस ले, take a deep breath. एंड दोबारा से चैट बॉक्स में अपनी एंजाइटी को रेट करें प्लीज राइट योर एंजाइटी स्केल अगेन इन द चैट बॉक्स व्हाट इज द नंबर नाउ आफ्टर सीइंग दिस वीडियो now if there is an increase in this scale this feeling thought emotion जो भी एक्सपीरियंस आपने किया उसे एंजाइटी कहते हैं this thought this feeling or emotion whatever you have felt during or after this video this is the anxiety please relax yourself before we move further take a deep breath with me inhale for 4 counts exhale for 4 again प्लीज रिलैक्स हो जाइए ताकि हम आगे बढ़ सकें 4 के काउंट पे आप इनहेल करिए स्लोली एक्सहेल करिए डू इट अगेन Great. Now explaining levels again. Level 1 is mild anxiety. हमें अलर्ट करता है चैलेंज करता है दिस एंजाइटी दिस हेल्प्स अस टू चैलेंज द सिचुएशन वी आर मोर अलर्ट इन दिस फेज हम इस एंजाइटी में फिंगर टैपिंग करते हैं एंजाइटी के दौरान हम नेल बाइट करते हैं वी बाइट आवर नेल्स एंड टैप आवर फिंगर्स व्हेन वी आर फेसिंग लेवल 1 एंजाइटी लेवल 2 इज द मॉडरेट एंजाइटी इसमें हमारा कॉन्फिडेंस लो हो जाता है इरिटेशन लेवल बढ़ जाता है हार्ट रेट इंक्रीज होता है गैस्ट्रिक डिस्कम्फर्ट स्वेटिंग ये सब हम एक्सपीरियंस करते हैं Level 2, moderate anxiety. We our confidence level stoops down, irritation level rises up, heart rate increases, gastric discomfort, sweating. We all experience these kind of things. Level 3, hypersensitivity and distorted perception. यानी हम एक्चुअल इवेंट का एग्जैजरेटेड यानी नेगेटिव रूप देखने लग जाते हैं. हमारा फाइट या फ्लाइट मोड ऑन हो जाता है. In this level 3 anxiety, we actually start exaggerating the situation or event to a level that we take the anxiety that take the situation to next level. Our fight, flight or fight mode gets activated. यहाँ मैं बताना चाहूंगी फाइट और फ्लाइट मोड एक्टिवेशन का मतलब होता है या हम सिचुएशन से लड़ने के लिए तैयार हो रहे हैं या हम उस सिचुएशन से भागने के लिए तैयार हो रहे हैं. Level 4, extreme anxiety. Person feel confused, distorted, pounding heart, lack of sleep, problem solving ability gets diminished. Present moment में जो awareness है हमारी वो कम हो जाती है. We are occupied with the thoughts. Lot of that. I hope I'm clear and not rushing too fast. Give me a thumbs up, please. Thank you. I would like to make my topic some interesting one, and I like to share a few facts in between. मैं आपको बताना चाहूंगी कि women are more affected than men with anxiety, likely twice, partly due to our hormones in play. Those are estrogen and progesterone. Now, next slide, please. Thank you. Intervention या anxiety को intervention या anxiety को रोकने का सुझाव. माइल्ड एंजाइटी डज नॉट नीड एनी मेडिकेशन. हमें माइल्ड एंजाइटी में किसी दवाई को लेने की जरूरत नहीं होती. वेयर इज ऑल अदर नीड टू बी ट्रीटेड. सही ट्रीटमेंट प्लान और उसे करने की लगन दोनों बहुत जरूरी हैं. एंजाइटी कैन रिटर्न इन मोस्ट अनएक्सपेक्टेड प्लेसेस एंड टाइम. फॉर योर इंटरवेंशन प्लान टू वर्क, परसिवियरेंस यानी ठीक होने की लगन इज द की. किसी भी हैबिट को बनने में 21 डेज लगते हैं. We need 21 days to make a habit. We help you choose your perfect treatment plan, and you are the one who is going to make it happen for yourself. We will discuss about treatment worksheets later in this workshop. Next slide, please. Now we will discuss in brief the type of anxiety. Panic attack. जैसे कि आप स्लाइड पर देख सकते हैं, पैनिक अटैक के सिम्टम्स हैं हार्ट बीट इंक्रीज होना, चक्कर आना, ब्रेथलेस होना, स्वेटिंग, नमनेस. कैन आई शेयर नेक्स्ट स्लाइड प्लीज? It can be explained as brief episode of intense anxiety which causes physical sensation of fear. It can happen with major life changing events, यानी किसी की डेथ हो जाना, ट्रॉमेटिक इवेंट्स जैसे कि सेक्सुअल असॉल्ट या डिवोर्स. Diagnosis of panic disorder is made if attacks are repeated, minimum 4 attacks a month. Now, next slide, please. जब हम किसी इंसान, जानवर, चीज या जगह से इतने डरने लग जाते हैं कि उन्हें खतरनाक मानने लगते हैं और हर तरीके से खुद से उन्हें दूर रखते हैं. Phobic disorder is fear related to a particular object or situation. It is diagnosed if experienced fear is intense or causes the patient to avoid the phobic object in the manner that limits his activities and impair his daily functioning. Agoraphobia. Next slide, please. Now, there can be three types of phobic disorders. Agoraphobia is the fear of being alone in public places. Example, lift या meeting hall में. They isolate themselves in order to avoid embarrassment. हमें लगता है कि हमें शर्म आ जाएगी अगर हम किसी के सामने किसी मीटिंग में, किसी क्लास में, किसी ग्रुप में इकट्ठे होके कुछ बोलने की कोशिश करेंगे. That embarrassment needed to be avoided and hence we isolate ourselves. Social phobia, extreme anxiety in public places. ये प्रॉब्लम लो सेल्फ एस्टीम से जुड़ी है। लोग खुद को आइसोलेट कर देते हैं। नेक्स्ट स्लाइड प्लीज। स्पेसिफिक फोबियाज आर फोकस्ड ऑन स्पेसिफिक ऑब्जेक्ट्स। लोग जानते हैं कि उनका डरना अमान्य है, पर स्पेसिफिक चीजों के सामने आते ही एंजाइटी हो जाती है, जैसे कि डॉग्स, कैट्स, स्नेक्स, इंसेक्ट्स, हाइड्स एंड मेनी मोर. Intense irrational fear of specific objects or situation like flying, heights, animal, maybe seeing blood, not including the situation mentioned in agoraphobia and social phobia. Next slide, please. Generalized anxiety disorder. It can be simply explained as severe ongoing anxiety that interferes with daily activities that last for minimum of 6 months. जब हमारी एंजाइटी हमें डेली रूटीन के काम करने में हमें इंटरफेयर करने लग जाए, और वो एक या दो एपिसोड को नहीं करेक्टराइज कर सकते, उसमें हमें कम से कम मिनिमम ऑफ 6 मंथ्स तक हम एज यू देखें कि हमारा 6 मंथ्स का टाइम हमें एंजाइटी हो रही है एंड वी आर अनेबल टू मूव ऑन विद आवर डेली लाइफ, डेली चोर्स ऑफ द लाइफ. In short, person starts worrying for everything. Persistent, excessive, unrealistic worry that lasts for 6 months and more. Next slide, please. Obsessive compulsive disorder, OCD. OCD is in which the patient experiences recurrent obsession or compulsion. इस परेशानी में इंसान को अनवांटेड थॉट्स बार बार आते हैं और वो एक ही काम बार बार करना चाहता है. इन शॉर्ट, एक्सेसिव थॉट्स दैट इज ऑब्सेशन दैट लीड्स टू repetitive behavior that is compulsion. Example can be hand washing, checking room door locks, counting things, money again and again in response to obsession. Now it's a fact check time again. Anxiety is not a mental disorder. Rather, some of our famous Hollywood celebrities like Cameron Diaz, Leonardo DiCaprio, Justin Timberlake had suffered from OCDs in their lifetime. Cameron Diaz fears touching doorknobs. Titanic star has some fascination towards not walking on chewing gum while walking on the road. Justin Timberlake has compulsion of washing hands frequently. Next slide, please. पीटीएसडी यानी पोस्ट ट्रॉमेटिक स्ट्रेस डिसऑर्डर किसी बुरी घटना को देखने या उससे गुजरने के बाद होने वाले तनाव को पीटीएसडी कहते हैं. पर्सन विल रीलिव ट्रॉमेटिक इवेंट्स थ्रू आउट unwanted recurring memories, flashbacks, or nightmares. People affected with PTSD may also experience depression, substance abuse, and suicidal thoughts. Next slide, please. Management of anxiety. Management of anxiety can be divided into two types. It can be through medicines, that is pharmacotherapy, and the other one is through the therapies like psychotherapies. Pharmacotherapy treatment include benzodiazepines, tricyclic depressants, SSRIs, yani selective serotonin reuptake inhibitors, and some beta blockers. But before starting my favorite part of this workshop, I would like to know if anybody needs to ask anything or any doubt. Show me thumbs up if everything is okay. Thank you. Is there any doubt? Fine, we'll move then. Please, next slide. Now we should proceed with therapies. Psychotherapy, in simple words, it can be explained as methods used to overcome problems, help change negative behaviors, increase happiness, and improve overall well being. Four psychotherapies can help in anxiety are supportive psychotherapy, behavioral therapy, CBT, yani cognitive behavioral therapy, and psychodynamic therapy. Before dwelling into therapies, I'd like to know आई वुड लाइक टू नरेट एन एग्जाम्पल। जब हमारे घर में वाटर पाइप क्लॉग हो जाता है, हम प्लम्बर बुलाते हैं जो अपना टूल बॉक्स लेकर साथ आता है। वो उस टूल बॉक्स में से हमारी प्रॉब्लम के अनुसार he just takes out any tool whatever fixes our problem. Exactly like this, we are here to provide you relief from your problems with our toolbox ready with us. Do feel safe in trusting us. For all your problems we have solutions. Let's have one more fact check. Our right side of brain is responsible for sympathetic nervous system. That is, it has role in responding to stressful situation. जब हम घबरा जाते हैं, जब हमारे पे तनाव बढ़ जाता है, हम सिर्फ अपने राइट साइड के ब्रेन को ओवरलोड कर देते हैं। इट कैन बी कंट्रोल्ड बाय रेगुलर एक्सरसाइज, डीप ब्रीदिंग एंड ग्राउंडिंग। हम इसे शांत कर सकते हैं, इस तनाव को कम कर सकते हैं रेगुलर एक्सरसाइज करके, डीप ब्रीदिंग करके एंड ग्राउंडिंग करके। मैं एक बात बताना चाहती हूँ कि जब भी हम तनाव में होते हैं, वी टेक शैलो ब्रेथ्स, वी ब्रीथ फ्रॉम अवर चेस्ट। आइडिया इज आप अपने दोनों साइड के ब्रेन को एक्टिवेट कर लो। बहुत इजीली हम कर सकते हैं दोनों हाथों से काम करके। फॉर एग्जाम्पल वॉकिंग, स्विमिंग, कुकिंग, डांसिंग, इन सब एक्टिविटीज में हमारे दोनों हाथ चलेंगे एंड देयरफॉर स्ट्रेस विल रिड्यूस। वी कैन ट्राई बटरफ्लाई हग टेक्निक एज वेल। बटरफ्लाई हग टेक्निक के लिए आपको अपने दोनों हाथ अपने चेस्ट पर क्रॉस करके रखने हैं। कैन आई सी नेक्स्ट स्लाइड प्लीज? Yeah, exactly. You have to cross your hands on your chest, intertwine your thumb. आप इस पोजीशन को मेंटेन करके डीप ब्रीदिंग करेंगे। यू हैव टू डीप ब्रीथ व्हेन यू आर प्लेसिंग योर बोथ हैंड्स ऑन योर कॉलर बोन। डीप ब्रीदिंग करें और ऑल्टरनेटिवली अपने हाथों से अपने चेस्ट पर पैट करें। यू नीड टू पैट ऑन योर चेस्ट ऑल्टरनेटिवली, once from the left side, then from the second hand. Do this for 2-3 minutes with closed eyes. Whenever you're feeling you are in a stressful situation and there's nobody you can talk to about, तुम किसी से बात नहीं कर सकते, you are all alone in your situation, may it be any. If your anxiety is about to start, you know something is going to get wrong, you can try butterfly hug technique. It will work for sure. आप जब डीप ब्रीदिंग करके अपनी पैटिंग करके अपने चेस्ट को कंफर्ट देंगे, there are a lot of hormones that feel good hormones that release in your body and lower down your anxiety. Now सपोर्टिव साइकोथेरेपी। जैसे कि नाम से पता लग सकता है कि सपोर्टिव साइकोथेरेपी में थेरेपिस्ट आपसे बात करके आपकी फीलिंग्स, परेशानियां सुनकर आपको इमोशनल सपोर्ट देता है। रोल ऑफ थेरेपिस्ट is to provide validation and encourage you in a safe, non-judgmental environment. Supportive psychotherapy helps you work through present and immediate concern जैसे कि relationship issue, family conflicts यानी घर परिवार की लड़ाइयाँ या work related stress. Next slide please. Supportive psychotherapy can be useful in treating anxiety, depression, grief यानी उदास रहना, PTSD हम पहले पढ़ चुके हैं, relationship problems यानी marital और familiar relationships, schizophrenia, etc. अब थेरेपिस्ट का रोल क्या है? What is the role of the therapist? काउंसलर कोई मैजिशियन नहीं है, वी आर नो मैजिशियंस। आपकी स्ट्रेस बकेट जो भर गई है वो उसे खाली करने में आपकी मदद करेगा। आप भी समझते हैं कि किसी परेशानी के चलते इंसान एक ही नजरिए से उसे सुलझाने में लगा रहता है। Counselor's job is to release your stress from bucket through numerous ways possible. Excuse me. I hope I'm clear till this part. जब हमारी स्ट्रेस बकेट when our stress bucket gets filled up with so many anxious thoughts all together, these needed to be vented out, and there the role of therapist come in. Give me a thumbs up, please, if I am clear till this part. Thank you. Now, other therapy is behavioral therapy. Systemic desensitization. इस टेक्निक को समझने के लिए Is anybody raising hand? Can I know, is there any problem? Is there any problem? Okay, I should proceed. Is there any problem? No, I guess. Systemic D.
Mahendraji, you can please wait a minute, Anilaji. Mahendraji, you can please switch on your mic and then you can say what the exact problem is, or you can even write in the chat box if
I
you are
guess he is
comfortable
not
over there.
aware that she is raising her hand, I guess. आपका hand raise है? I guess she's not aware of that. Fine, I should move then. Then systemic desensitization इस टेक्निक को करने के लिए क्लाइंट अपनी उन बातों को, चीजों को बताता है जिनसे उसे एंजाइटी होती है। 0 से 10 तक की रेटिंग की जाती है। फिर रिलैक्सिंग एक्सरसाइजेस जैसे मेडिटेशन या गाइडेड इमेजरी, पीएमआरटी प्रोग्रेसिव मसल रिलैक्सेशन टेक्निक जिसमें ऑल्टरनेटिवली क्लाइंट से मसल टेंस करके रिलैक्स करने को कहा जाता है। In PMRT, we do alternative relaxing and we rate before this we rate the anxiety level of the numerous problem a client may be facing. जब क्लाइंट मेडिटेशन या डीप ब्रीदिंग रिलैक्सेशन करके रिलैक्स हो जाता है उसे उसी की 0 से 10 तक की एंजाइटी लिस्ट की आइटम्स बताई या दिखाई जाती हैं जिससे उन बातों का धीरे धीरे उसका तनाव कम होता जाता है। When a person has went through the relaxation procedure, those list of anxiety with 0 to 10 rating, whatever the person has written on his own, that we will show him to that person again, and he will gradually try and understand that those were only thoughts, those were not actual problematic things, and this way his stress will released. This therapy helps building confidence they need to overcome their fears. Flooding and ERP are the advanced version of this therapy. आगे बढ़ने से पहले I will request you all to close your eyes and we will have a meditation video for few minutes. Kindly अपनी आंखें बंद करिए और meditation की power को आजमाइए. Please meditation video.
So find a relaxed, comfortable position, seated on a chair or on the floor, on a cushion. Keep your back upright, but not too tight. Hands resting wherever they're comfortable. Tongue on the roof of your mouth or wherever it's comfortable. And you can notice your body from the inside, noticing the shape of your body, the weight, touch. And let yourself relax and become curious about your body seated here, the sensations of your body, the touch, the connection with the floor or the chair. Relax any areas of tightness or tension. Just breathe, soften. And now begin to tune into your breath in your body. Feeling the natural flow of breath. Don't need to do anything to your breath. Not long, not short, just natural. And notice where you feel your breath in your body. It might be in your abdomen. It may be in your chest or throat or in your nostrils. See if you can feel the sensations of breath, one breath at a time. When one breath ends, the next breath begins. Now, as you do this, you might notice that your mind may start to wander. You might start thinking about other things. If this happens, this is not a problem. It's very natural. Just notice that your mind has wandered. You can say thinking or wandering in your head softly. And then gently redirect your attention right back to the breathing. So we'll stay with this for some time in silence, just a short time. Noticing our breath, from time to time getting lost in thought and returning to our breath. See if you can be really kind to yourself in the process. And once again, you can notice your body, your whole body seated here. Let yourself relax even more deeply. And then offer yourself some appreciation for doing this practice today. Whatever that means to you. Finding a sense of ease and well-being for yourself in this day.
I hope you feel relaxed. Show me your thumbs up. Nice. Now, next therapy is CBT, cognitive behavior therapy. Right. CBT helps client in correcting maladaptive negative patterns. When we challenge and change our unconscious mind patterns, they help us to improve the way we feel, leaving us less anxious and worried. CBT ऐसा एकमात्र तरीका है जो आपको सेल्फ रिलायंट बनाता है. फॉर एग्जाम्पल आपके बॉस ने आपको लंच के बाद बुलाया है. आप जब तक लंच कर रहे हैं दिमाग में 100 ख्याल आ जाते हैं. कहीं मुझे फायर तो नहीं कर दिया जा रहा, कहीं मेरे काम में कोई गलती तो नहीं, कहीं किसी ने मेरी शिकायत तो नहीं लगा दी, बॉस के बुलाने की वजह क्या हो सकती है. या जैसे आपके हस्बैंड वाइफ 1 घंटे में घर पहुंच रहे थे पर किसी कारण नहीं पहुंच पाए. आपका दिमाग फिर चलेगा कि कहीं कोई परेशानी तो नहीं होगी, कहीं कोई चोरी एक्सीडेंट या कुछ और बुरा तो नहीं हो गया. Once we start assuming negative thoughts, we become anxious. When we become anxious, our mind gets flooded with more negative thoughts. This is a vicious cycle. As soon as we change our negative thoughts to positive thoughts, we become less anxious. Therefore, that's the idea of distraction. Like reason says, whatever you are doing, do opposite. ऐसी सिचुएशन में जब हम फैक्ट्स के साथ अपने थॉट्स जोड़कर उन्हें दोबारा देखते हैं तो कई बातें क्लियर हो जाती हैं। कई बार जब हम नेगेटिव बात बार बार बोलते हैं दे टेंड टू गेट स्टोर्ड इन अवर माइंड, तो हमें नेगेटिव बातों से ध्यान हटाकर पॉजिटिव में लगाना पड़ता है। All we need is to correct our thinking as we cannot control our thoughts. They come and go, but we can focus on positive facts, which is in our hands. हम सिचुएशन नहीं बदल सकते, but all we can do is change the way we react to the situation. Do you believe this is true or not? Show me a thumbs up. Right. Now proceeding towards ending and telling you quick fixes that allows you to start right here, right now, before it's too late. बट एक बात बोलना चाहूंगी कि अगर आपको पानी में फेंक के मैं तैरना सिखाऊंगी तो आप नहीं बच पाएंगे। आप तभी स्विम कर सकते हैं जब पहले से ही जाने कि परेशानी में पड़ने से पहले मैं सोचना शुरू कर दूं कि मैं परेशानी आए तो मुझे निपटना कैसे है। लाइक मैल्कम फोर्ब्स सेड, आई एम सॉरी, इट्स नेवर टू लेट टू लर्न। नेक्स्ट स्लाइड प्लीज। एक्सक्यूज मी। या नेक्स्ट स्लाइड प्लीज। Healthy diet, exercise regularly, regular quality of sleep, positive affirmations. Yeah, the one before. Sorry, this one. Yeah, this one. नहीं ऊपर प्लीज, ऊपर वाली स्लाइड, 21st slide. Yeah, thank you. Healthy diet, exercise regularly, regular quality of sleep. हमें positive affirmations, they all go hand in hand. Other things can be journaling your thoughts, writing down your thoughts, writing down your thoughts that triggers what situation, things, or event trigger your anxiety. What thoughts came to your mind? What emotions you felt? Now, what were the evidence, facts that supported your thoughts? वो सब चीजें जब हम पेन डाउन करते हैं जिनसे हमें एंजाइटी होती है या हम एंजाइटी फेस कर चुके हैं, उन थॉट्स को, उन ट्रिगर्स को, उन बातों को जब हम लिख लेते हैं, जब हम रियलाइज करते हैं कि ये थॉट्स बस हमारे ओपिनियंस हैं, इन ना कि फैक्ट्स, हम तनाव से बाहर आ जाते हैं। हम जब उन्हें एक रीजनेबल एक एक्सप्लेनेशन देते हैं तब हम वी कैन कम आउट ऑफ द एंजाइटी ऑन अवर ओन। Number two is locus of control. Next slide, please. The other one. Yeah. Now, this is the locus of control, and we all can make it. Writing down things you can and cannot control separately will clear your mental fog. हमारी हर सिचुएशन में, हमारी डेली लाइफ में कुछ ऐसी बातें होती हैं जो हम कंट्रोल कर सकते हैं, कुछ ऐसी बातें जो हम कंट्रोल नहीं कर सकते। जब हम उनको अपने माइंड में अलग अलग जगह दे देते हैं, व्हेन वी राइट थिंग्स वी कैन कंट्रोल एंड कैन नॉट कंट्रोल, this gives our mind a clarity and clears our mental fog. For example, you can control your thoughts, actions, decisions, your attitude, your behavior, self care, etc., but cannot control people's reactions, others' opinions, others' mistakes, weather, economy, etc. Number three is focused breathing and meditation. Imagine visualized breathing. Breathing in blue, the relaxing energy, and breathing out red, that is anxious thoughts. इनहेल करते वक्त हम सिर्फ ब्लू चीजों के बारे में, ब्लू कलर के बारे में, ब्लू एनर्जी के बारे में सोचें। एंड एक्सहेल करते वक्त हम अपने एंशियस थॉट्स, अपने नेगेटिव थॉट्स जो हमें बॉदर कर रहे हैं, उनको अपने शरीर से अपनी सांस के साथ बाहर निकालें। दिस इज कॉल्ड विजुअलाइज्ड ब्रीदिंग. Guided imagery is like a brief mental vacation. Other one is relaxed breathing. Inhale for 4 seconds through nose, hold for 2 seconds, release for 6 seconds. Then pause and start again. Remember to breathe with stomach and not chest. Shallow breathing is a mandatory thing. हम tension में we do we do very nominal breathing. We take breath from our chest. We don't exhale, inhale properly. This stress को rise करने के लिए this is very tension. Sorry, very stressful. Number four, acupressure points for temporary anxiety relief. Next slide, please. Yeah, this is about meditation and breathing. Next slide. Yeah, acupressure points. Acupressure points for temporary anxiety relief. Acupressure एक anxiety एक relief करने का ancient technique है जो temporary relief आपको दे सकता है. First point is at our ajna chakra यानी eyebrows. आईब्रोज के बिल्कुल सेंटर में जहां हम बिंदी लगाते हैं. Sit comfortably and apply pressure with index finger or thumb in circular motion. You should do it for 5 to 10 minutes. Second point is at just 3 fingers below our wrist. Apply pressure to point for 4 to 5 seconds. ये दोनों पॉइंट्स शुरुआती स्ट्रेस कंट्रोल करने में आपकी मदद कर सकते हैं, पर सिवियर परेशानी में यू शुड कंसल्ट थेरेपिस्ट. सॉरी. Number five, affirmations. When you repeat empowering statements regularly, you start to focus on present rather than negative. Therefore, decrease anxiety symptoms. All you can do is say, I am safe. I am in control. I am strong. I trust myself. I am loved and accepted. You can say all these affirmations twice or thrice a day. This will help you calm down in regular basis. अंत में यही कहना चाहूंगी कि as small drops can create far-reaching ripples, small changes can have far-reaching outcomes. You have choices to change. Thank you. Over to you, Ria.
Thank you so much, Anila ji, for this wonderful workshop. Today we learned a lot about what exactly the anxiety is, what are the main symptoms, what are the levels of anxiety, how it can affect in our day-to-day life, and what are the basic interventions that we can use in our day-to-day life to overcome these issues. It's a very grateful workshop that you took, and I hope everything is clear to our all participants. If you have any doubts or any query, you can raise your hand and ask your doubts now. Okay. I'm assuming that everything is clear from your end too. So if you want to add anything, okay. Is there is one doubt? Yes, Vidyaji, can we know what exactly your doubt is?
Yeah, I have a situation like I got a client for counseling. He's a boy. I just want to know at the time he was not agitated or frustrated or anything. He was normal while talking. But the thing is, he was fidgeting. Can I associate that with the anxiety level or something?
Associate with something what I didn't understand the
Anxiety,
last word.
anxiety, anxiety. Fidgeting. He was doing fidgeting. He
Okay.
was having a fidget.
Okay, so as you told me about the visiting, is there any occurring thoughts in his mind that is repeating day by day, and after that this visiting occurs?
That fidgeting, he was throughout the session, he was doing that. But
Okay,
the thing is, he has anger issues. That he told me.
okay. Any
Yeah.
other specific thing that you can told me about the client?
Actually, needs not met. Love and belonging is not met. And there was a grief in his life, like his grandpa passed away. From that, his anger is increased. So I just
Okay,
wanted to know during the session he was doing this fidgeting. So can
okay.
I associate that with like being exposed in the session? Is that a reason or is that a symptom of anxiety in him? Because only one session I had, that's why I'm asking.
As you told me this much about the client, we can say yes, you can associate it with the anxiety, but you can't be
Okay,
sure. For being
okay,
sure that whether the client is suffering from anxiety or not, you can use different
yes,
assessment. The basic assessment
okay,
is back anxiety inventory. Okay.
okay,
And second
okay,
thing, just try to find out whether this
yeah,
fidgeting is related to any thought that the client is having. For
okay,
example, maybe while doing the session, he might have this thought.
yes,
Maybe the therapist is judging me. What if she just scold me like
okay,
my parents or something like that?
okay,
What if
okay,
she also leave me? So this can also be a
yes,
symptom of OCD too. Or sometime
okay,
when we are okay to open up in front of a stranger, this is like our
yeah,
habit or in our behavior too, that we fidget.
okay,
Sometimes clients fidget just because they are nervous or they have that particular emotion or behavior they want to hide from the therapist. Just
okay,
dig a little bit more. But I'll
okay,
recommend you to do a back anxiety inventory test. That will help you a
okay,
lot to know what exactly is going with the client.
sure, sure.
Okay.
Thank you so
Uh,
much.
Welcome. Any other doubts from anyone?
Yeah, ma'am, I wanted to ask, where can we get the Bex anxiety? Is it available online or we need to purchase it?
No, no, it's available online also. But for the reference, I will send it in the workshop group that in which you are all added.
Okay,
Okay.
okay, thank you.
This is what I can do for you.
Yeah, yeah, thank you.
Yes. Any other thing? Any other question? Okay. So we are
Ma'am,
at the end
it's
of.
yeah,
Yes,
sorry, sorry. Yeah,
it's okay.
it's like while conversating, somebody gets palpitation and sweating. These are basic signs for anxiety.
Yes.
So if somebody gets at a particular time, like if somebody is going to pass a tunnel and then they're like, no, 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 I don't want to go, I don't want to go. It's a lot of fear. No, 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 I'll die inside it.
Yes.
So what could be the suggestions for that person? I mean, how can we help that person? Because that's the only point the person is very scared. One of my clients.
Y-
So she
Yes,
was
this
like, no, I am
happens.
so dreaded to just see a tunnel and I feel like I'll die. In that
I
condition,
understand this. This happens to a lot of clients, just not because of the tunnel, because of the different situations too. Like some clients are afraid of like spiders, afraid of heights, claustrophobia. It means afraid of being in lift or afraid of being alone in their life or anything like that. Okay,
yes.
so exposure therapy is the best technique that you can give. As also in our workshop, we have covered a small part of systemic desensitization where we told you that how you can make a list of all the things that make him scared and after making that list you can go from one step to the another step, like as the client said that he will feel like dead when he was in the tunnel. You can told him, okay, so what are the basic things from you can made a like a ladder. What are the least things that make him scared about the tunnels, and what are the highest things, and you can move to the lowest to the highest while using the meditation that we have used in this session. I will also
Okay.
send the YouTube
Yeah.
video link in the group that will help you out if you want to give that same meditation to your clients too. And second thing,
Yes.
if he is in the real life, he or she is in the real life situation and you want to help that client in the particular situation, then go with the grounding techniques, that is 5 4 3 2 1. It means what we have to do in this technique, we just have to told the client, just take a deep breath, relax yourself for a bit, and notice the 5 things around you that you can touch, 4 things around you that you can hear, 3 things that you can see, 2 things that you can smell, 1 thing that you can eat around you.
Okay. Okay. Yes,
Okay,
get that.
this
Yeah,
will,
yeah.
yes, this will help the client to change their focus from the particular danger to the pleasant memories. and this will help to him to basically explore that situation and to be calm in that particular situation. And after using this thing also, you can use exposure therapy on the client too.
Okay.
I think I got your doubt very clearly.
Yes, yes, definitely. Thank you so much.
Welcome. Any other doubt? Any other questions? Uh,
Ma'am, can you please repeat that 54321 technique so that I'll note it down?
I will send that thing also in the group. Don't
Fine,
worry.
fine, ma'am. Thank you so much.
Yes, yes. And
Actually, I
also,
heard this technique as one somebody told me about 333. Like you said, five,
yes,
four, three, two, one. Yeah,
yes,
333 was also there.
333 technique is also very good. 333 technique is also same as this 54321, but
Yeah.
it's like 54321, we are involving all our five senses
Okay.
because we
Yes. Yes. Yes.
perceive everything from our five senses. And if our five senses are blocked in a particular situation, no danger or no other information is getting inside our body or in our senses.
Yes. Okay. Okay.
Yes,
Right.
yes. So now we are wrapping this workshop. And before we wrap up, I just want to inform you that for the PPT of this workshop, and if you need these anxiety worksheets and workbooks that you can use with your clients, and even if you need the certificate of this workshop, you can fill the form I will send in the group again, and you have to pay 59 rupees, and you will get the certificate and the resource material about the anxiety. Also, if you are not a practitioner, and if you need a therapy sessions, that then we provide individual therapy sessions, life skills development, marriage and family therapy sessions, stress management, couple relationship counseling, career counseling, mindfulness training, and substance abuse counseling to the clients at very affordable rates. Next slide, please. Next slide, please.
Ma'am, you're not audible clearly.
Uh, am I audible now? Am I audible now?
Yes, now you are.
Yes. So I'm telling you that if you are a psychological professional, then you can buy our 59 rupees resource material and certificate. And if you are a non from a non-psychological background, and if you need a therapy sessions to know more about yourself and to overcome your day-to-day life challenges, then you can book our services. That includes individual therapy session, life skills development, marriage and family therapy sessions, stress management, couple and relationship counseling, career counseling, mindfulness trainings, and substance abuse counseling. Next slide, please. Yes, for that, you can scan this QR code or contact on these numbers. And even I've shared the link in the chat box. You can book your session through that link also. Thank you so much, everyone, for being with us today for such a long time, for being so patient. I hope you learned a lot from us today. And if you have any feedbacks or any suggestions, you can give us here or even on the groups. That will help us to improve day by day. Thank you, everyone,
Ma'am,
for being
what
with
is the
us.
fee for these services?
Actually, we have a minimal session of rupees 500, and we have many packages, and it is
Okay.
depend on whether what the basic services that the client required.
Okay, okay, fine. Thank you.
Yes, everything is you will find from the QR code. Just scan it, and you will get each and everything that you want to know, or you can
Okay,
contact on
sure.
these numbers. Thank you so much all for your valuable time. I hope you all loved it and you learned a lot from us today. And if there is anything that you want to tell us, just let us know so that we can improve us too. Thank you, everyone.